Well, everyone knows that we are now engaged in a great debate about health care reform in the United States, a way to provide health insurance to all Americans. But I get a lot of questions about how this large debate affects people in the lesbian, gay, bisexual, and transgender community. And I want to take a few moments to detail some of the reasons why, as a community, we ought to be very focused in on the health care reform debate. First of all, certain groups in America suffer from disparate results from the healthcare system. We call this healthcare disparities. A lot of attention has been paid to racial, ethnic, and geographic disparities, but we also know that the LGBT community has disparate access and disparate outcomes from the healthcare system. What is challenging about this is that we don't collect data on the impact of these disparities on the LGBT community. What I mean by that is that we have many federally funded health research and survey tools that allow us to understand who is well served and who isn't well served by our current healthcare system. None of these federally funded surveys ask any question about sexual orientation or gender identity. In fact, the only information that we have about the disparities that are felt by the LGBT community are from privately funded, smaller, or local health surveys. This is something that we are changing in this healthcare reform bill, and something that will be of great importance as we seek to have a healthcare system that treats all equally. Another issue that's very important in the LGBT community is the fact that, by and large, we tend to be less insured than our heterosexual counterparts. And one of the reasons for that is that in many cases, in many jurisdictions, our relationships aren't recognized. So in a situation like my own, where my partner of 14 years is not recognized by the federal government as either my spouse or my domestic partner, I can't get family health insurance that covers her. Many same-sex couples across the United States find themselves in the same circumstance. Because this bill aims to provide health insurance for all Americans, that high level of uninsurance will hopefully decline. There's also another very important tax measure in this health insurance reform legislation that we're working on. Those who are fortunate to be working for employers who recognize their partnerships and provide family health care benefits for them, those individuals also pay a sort of tax penalty, an extra tax that their straight married counterparts don't pay. We are repealing that tax penalty in this legislation. So there are many reasons why people in the LGBT community ought to be following healthcare reform very closely. Our lives are very much going to be affected by this legislation, and certainly our health is. So I commend close following of this legislation among the lesbian, gay, bisexual, and transgender community.